Good morning, everyone. I'm here at the Mundaring Arena, which has been set up as the DFES Incident Control Centre. I was here yesterday afternoon as well to get the latest briefing on this devastating fire emergency. In a moment, DFES Commissioner Darren Clem will provide you with the latest on the bushfire emergency. But first I'd like to say a few words. Western Australia is currently in the midst of an unprecedented situation. We're fighting disasters on two fronts: the devastating bushfires and the COVID-19 pandemic. This is a situation the likes of which we have never seen before. A full lockdown and raging bushfires. It is frightening and it will test us all. The fires have already devastated our community. We know that 71 homes have been lost. That number is expected to rise. To all those who have been impacted by the fires, can I say, every single Western Australian is thinking of you today. We offer our thoughts and our support and stand ready to help in any way that we can. We've all seen the vision on the news. Homes and memories going up in flames. It's terribly sad. People doing everything they can to defend their homes. Firefighters putting themselves in danger to protect others. Our firefighters and emergency services teams are doing everything they can to protect us. As I said yesterday, they are true heroes. I have briefed the Prime Minister on the fires this morning. We have secured additional support from the Commonwealth, and the additional large aerial tanker is now operational in WA, and I'd like to thank everyone, including the Prime Minister, for their assistance. Can I again urge people to listen to the advice and follow the instructions? It could save your life. There is a threat to lives and homes. This is an extremely dangerous fire. If you live in Shady Hills or Bullsbrook, you should leave now. Please visit the emergency website or call 13 DFES 133337. Follow DFES on Facebook and Twitter and continue to listen to local news bulletins. Look after yourselves and each other. Please stay safe. Like many people, I know someone who has lost their home. It's devastating. To all those people in the evacuation centres, we're all thinking of you. I'll be visiting later today to offer my support. Now, on to COVID. After 2 days of full lockdown, Western Australia recorded no new cases from the test results received. That's 3 days in a row of 0 new cases. Can I say from the outset, this is a very encouraging result, especially considering we have been testing at record levels, but we are not out of the woods yet. We've had another incredible day of testing. In total yesterday, WA recorded a total of 12,326 tests. That is a very good number of tests, but we want to keep the number of tests at a high level. That means even if you recently received a negative result, if you begin to feel unwell or experience any symptoms, go get tested again. Take nothing for granted. The more we test, the more confident we can be to get back to normal. To those who've been to one of the exposure sites, you need to be extra vigilant. Get tested. If you feel unwell at all, get tested. West Australians have been outstanding when it comes to testing. Let's keep it going. If we continue on our 0 cases streak, that would be a great achievement, a credit to all West Australians. I want the WA community to understand that if we do continue on a 0 streak through till Friday, the full lockdown will end. However, like we have seen in other states, some form of restrictions will be necessary for the following week or so. Based on health advice, we know this virus can linger. So even though we could potentially have no community transmission come Friday, it does not mean we are 100% in the clear. I want to get back to normal as quickly as possible, but we need to see at least 14 days of no community transmission before we can return to our unique life here in Perth and WA, southwestern Peel, that we were all enjoying throughout January. Our extensive testing and contact tracing is continuing. Our Chief Health Officer has advised that in total, 189 close contacts have now been identified. 138 of these have returned negative results. In addition, 234 casual contacts have also been identified. 116 of these have returned negative results. Test results on others will be confirmed soon. I can also add that the 3 housemates of the confirmed case have been tested again. The results of these tests are pending. We will keep you updated on these tests. These people remain in hotel quarantine. I can also report that yesterday, 54 guests at the quarantine hotel were due to be released. We held them back for an additional COVID-19 test to be carried out. The results all came back negative, and they will now be released today. I also want to make this point. There is a lot of misinformation being thrown around about how we have low stocks of PPE. This is completely untrue. Throughout this pandemic, we have prepared and have all necessary PPE in stock. Misinformation and fear-mongering being peddled by some individuals needs to stop. It is not helping the situation, and it's creating anxiety for many people. Just to be clear, we have more than enough PPE. I'm advised it has been distributed to our health services, so they have more than enough in stock. I also want to report that the 13 COVID hotline has been very busy in light of this week's lockdown, which is understandable. Since Sunday, there has been 27,291 calls. Can I request that people are patient if they're having trouble getting through? Information on the lockdown is also available at www.wa.gov.au. I want to also thank the many people who have been staffing these phones and performing this service for our state. We have significantly increased resources to the hotline. That goes to everyone across the state. Essential workers, our police, our firefighters, our nurses, those people working on the front line, including those working in shopping centres, our essential retail workers, our truckies, cleaners and security staff. Thank you. You're doing an incredible job in this extremely difficult time. Can I again give my sincere thanks to the people of Western Australia for their response to our latest COVID-19 challenge. You are showing the world what can be done when people come together and do everything they can to keep their community safe. I'm so proud of each and every one of you, but it's not over yet. We have not yet defeated the virus. The fire is still burning and we have volatile weather conditions in front of us today. We need to keep it up. We need to stay the course. We cannot get complacent. It's more important than ever that we continue to observe the lockdown rules. Stay home unless you need to leave for any of the permitted reasons. We know how quickly the virus can spread. If you're in Shady Hills or Bullsbrook, please leave now. We know how quickly things can go bad. I can't thank you all enough. The Lord Mayor's Distress Relief Fund has now been activated by the City of Perth and Lord Mayor Zemplis. The state government will make a $2 million donation on behalf of the West Australian community to this important fund. I'll now hand over to DFES Commissioner Darren Clem, who will update you.
Thanks, Premier. In terms of an update on the fire here at Wooroloo, the last 12 hours overnight have seen the fire largely remain static. Some really much milder conditions than what we experienced the night before has meant that some potential impact on homes in the northern part of Brigadoon has been averted, and crews have worked really hard overnight to keep the fire out of there. It's also allowed us the opportunity to build some breaks along the southern flank and parts of the northern flank. Of immediate concern today is the suburb of the estate of Shady Hills Estate, which is in the northwest portion of the fire. That northwest corner of the fire is extremely difficult to control in incredibly steep terrain We're unable to get earth moving equipment in there. We've been using both large air tankers and fixed wing water bombers to lay retardant lines in that area late last night and then also into this morning. But just before we've come to this press conference, a telephone warning system has been released for Shady Hills Estate and the greater part of Bullsbrook. People in those areas, now is the time to enact your bushfire plan. If you are not prepared, you should leave now. I just want to reiterate that. It's absolutely critical that people enact their bushfire plan now, and if your decision is to leave, you should leave now. We're only going to see the wind strengthen over the course of the day, which will make that fire in difficult steep terrain incredibly difficult to stop running up the hill towards Shady Hills Estate. I can also advise that animal welfare is now being managed from here. A series of vets and teams have been established with the two local governments, the City of Swan and the Shire of Mundaring, and they're ready to deploy into the fire affected area to treat and manage animals that have been affected by the fire. I can also advise that the disaster relief funding criteria have been met, and only just before this press conference that's been established has been triggered, and we will work with the federal government to access the funding as well as support from the state government. I'd like to thank all of the volunteer firefighters that we've had on the ground, the career firefighters, the people from firefighters from the DVCA for their assistance, and also from all of us, our hearts go out to those that have lost homes. This morning, the process of communicating the loss of those homes to the homeowners has commenced, and I know that all of our thoughts are with those people in what has been a difficult couple of days for them, and we know that both the next couple of days and months ahead are also going to be incredibly difficult as those people come to terms with the loss of their houses. We support them and we acknowledge the sacrifices that they've made in protecting their properties. Can I also thank the local governments of City of Swan and Mundaring for their assistance to what we're doing here today. It really is a team effort, and one of the many fantastic things about both the public sector, local governments and volunteers from COVID is that desire of everybody to work together for the common good, and it is a fantastic part about emergency services here in Western Australia. Thank you. Is it you, Duncan?
Like Western Australians have done in the past, we've seen our community respond and rally to these two major emergencies that we have. In respect of the fire, can I reinforce and echo what has already been said here this morning. If you are in those danger zones, heed the warnings. Leave those areas of Shady Hills and Bullsbrook now, and monitor ABC Radio, all other media, and indeed the Emergency WA websites. All that information is there, but please heed these warnings and leave those areas. In regard to the fire itself, I've taken a briefing in terms of where it started. We understand and we're quite certain it started in the locality of Werribee Road near Great Eastern Highway. The cause of that fire is undetermined. We don't know exactly how that started. There's no criminality that has been identified at this point, but it is undetermined. In regard to the COVID-19 pandemic and the lockdown, we can be once again very pleased at the numbers of people that have come through for testing at the clinics. In respect to compliance, we are seeing people very compliant in terms of the movement across our intrastate regional boundaries, but we're also seeing very broad compliance in the wearing of masks. There have been several instances where people have been belligerent, refused to wear them, even when they've been offered them, and several people have been arrested and infringed, but the very vast majority of Western Australians are wearing masks. We want you to continue to do that to assist us in stopping any spread of COVID-19. I'll make several comments about case 903, the security guard at the Sheraton Four Seasons Hotel, the police investigation, which is complementary to the health contact traces, and we're working side by side with them, continues. I've not received their final report because they're still doing it. What we can establish is that the guard that we're speaking to remains very cooperative. He is assisting in the questions that are being put to him, and there's nothing that he has said that we've been unable to corroborate, nor is there any criminal offences being identified. He is being cooperative. What we do know is that he was deployed in that hotel as a static guard, seated in a corridor outside a area close to a room, and Minister Cook will be following me to explain the nature of what happened that we can establish in terms of access and the vicinity of that guard to a nearby room, which we know through the serology and genomic testing that the occupant of that room has the same UK variant strain, and the genomic testing, we're very confident that that is where, based on the health advice, the security guard has been infected. In terms of his movement in the community, there's nothing to suggest that he's been anything other than cooperative. We've seen record numbers of people in the localities that we've asked who have come forward for testing, and pleasingly, including his flatmates, including all those close contacts, and including the broad community, to date there are no reported infections from the nearly 30,000 tests that have already been done to date. The police investigation will continue. We'll continue reviewing CCTV, any communication and any financial records, and that will remain so until such time as we thoroughly complete this element of the investigation. We have a meeting already conducted with Professor Taran Wiramanthri, and Professor Wiramanthri is a very highly credentialed public health physician. He will oversee, from his perspective, any clinical and public health review, and I will be speaking with him on the completion of his initial brief tomorrow, and we will respond to any recommendations he has. So I stress again, we are getting progress, and there's nothing untoward at this point in time in terms of what we are terming case 903. I can just close on a couple of comments regarding the fires. You've heard the warnings put out. I know that there are reports of alleged looting. I have 2 reports of burglaries, one in the suburb of Averley, a home that was evacuated as a precautionary measure with the fire situation, and another home in the locality of Red Hill. In both instances, a small number of items were stolen from those homes. The occupants had left as a consequence of the evacuation. We have deployed many police cars who remain on patrol in the areas that have been evacuated, and that will thoroughly continue. So I can confirm that there are presently 2 burglaries that have been reported, but I would not, and I'm not trying to underplay this, I would not characterise this as looting, but it is of course a serious concern that there have been 2 burglaries in the evacuated areas in those 2 localities. That's all I'll have to say. Thanks very much.
What I think we might do is get any questions to Commissioner Clem first.
Commissioner, just on the Premier mentioned Bullsbrook, you might mention Bullsbrook.
Yeah.
So some of the assets around there, like RWS,
We're concerned about all the infrastructure in and around, all the way from Shady Hills Estate through to Bullsbrook. There's a significant number of homes through that area, and of course RAF Pearce Air Base as well. We've got rural urban interface teams that are already in Shady Hills Estate and have been in there for some period of time, and they'll be bolstered by further crews coming in from the north and the south to support them.
Can you tell us about the contribution of regional crews who travel to help?
Yeah, look, it's very much a part of volunteer emergency services personnel that we see volunteers come from all across Western Australia, and even today I've seen crews here from the local government area of Albany, which is absolutely fantastic. But importantly, very much an important part of our response to bushfires and cyclones across Western Australia is that desire for volunteers to move around the state wherever those emergencies should be, and it's a great support to us meeting our responsibilities.
Just on the advice area, it's huge. It
Yep.
covers large parts of northern suburbs of Perth that probably have never even thought about bushfire threat. What would be your message to those residents?
The message is that establish a plan. If you haven't done a plan, now is the best time. Go onto the My Bushfire Plan website, download the app, and work out what your plan's going to be should a bushfire impact your area. And I think the important point with this is that people who live in suburban areas need to understand that we put these warnings out because only on Monday night, we had that particular bushfire. The Woolloomooloo bushfire was spotting 3.5 kilometres ahead of where the fire front was at night time. And so people who think that they're not on the street that's opposed to the bush, and so they're not at risk from bushfire, well, you're wrong. You need to have a bushfire plan. If we've put you into those, if those warnings have been put on particular areas, then they've been put on for very good reason, and people need to prepare themselves.
And so, just quickly as well, has there been any update on the number of properties affected?
No, there hasn't, other than what I'll say, the figure I gave this morning was 71. I can tell you that the rapid damage assessment teams have almost finished their work, and so in terms of the current footprint of the fire, they've been working on those homes that have been impacted on the current footprint, and that number is 71. I would expect it's going to rise marginally before they finish that 100% of it. There's a section out on the western edge that they're unable to get to, and they're currently working through that with a helicopter to establish what, if any, damage exists there. Sorry, I'll just cover off on that, and as soon as we get that final number, I'll make that available.
Some regional communities are doing their best to help. We've heard reports of people organising truckloads of donated items and things like that.
Yeah.
How practical is that during a lockdown? How can people best help?
Look, I think the best way that people can help, and you heard the Premier announce the Lord Mayor's Distress Relief Fund. That is the best mechanism for people to donate money into that fund, and they know that money that's going to get donated there is going to to best support the community that's affected by the bushfires. All right, thank you.
Thanks very much, everyone. Can I just add my thoughts and thanks to everyone involved in the bushfire incidents, and we wish everyone the very best. Obviously, over 30,000 people have been tested since Sunday. That is a really pleasing result, and obviously I'm delighted that once again we've had no new positive cases. I just wanted to provide an outline in relation to what we regard as the potential transmission event, and provide people with some information just so we can continue to inform the public. So essentially what we're looking at is an event which we suspect occurred on the 24th of January. Case number 903 was deployed to a static location consistent with the role of the security guards. So he was based, as I said, at a static location near the stairwell, at least 2 doors away from the room of the person that we think was responsible for the transmission of COVID-19. It consisted with the public health advice. He wasn't required to wear a mask while he remained in place, and that is consistent, as I said, with the public health advice, and basically carried out his duty from that point. His role there was to monitor the floor to ensure that no one left their room, and as I said, was sitting in a chair near the lift well, a safe distance from the room in question. We know that the room in question was visited around 7 times that day, and yesterday we reported that the security guard in question delivered some medication to that room. I can now clarify that he was not the security guard that did that. The only people who visit rooms in these incidents are authorised personnel. be that security for inquiry, medical staff, or people dropping off food and other items. Each of the people who visit the rooms carry full PPE and are protected in relation to any exposure that they might have to the person indoors. We have established that all on that day wore the appropriate PPE. The security guard did not approach the door during the day, and however, obviously you could understand with 7 different visits during that day to the person in question, it would appear that there's some spread of the disease. Now, I understand there'll be lots of questions in relation to this, and I stress that this is the scenario that we are testing as part of the investigation into the transmission event, and it will be subject to a full report from the public health officials who are oversighting this review. And obviously, as that report is finalised in the coming days, we'll bring all those details to you. Now, I also understand that you have lots of questions in relation to the public health protocols associated with personal protection equipment in a hotel quarantine environment. So I've asked Dr. Paul Armstrong, who's known to you all, an expert in communicable diseases, to be able to come and answer your questions in relation to that matter. But I stress, at no stage were people not acting in the complying fully with the public health advice. And there's been no advice from the government that is contrary to that advice, and these are operational matters over which the public health experts have full authority. I just invite Dr. Armstrong to answer any questions you might have.
Dr. Armstrong, are we to believe that the security guard sat in his chair all day and got infected by one of the other people who had been infected personally? In which case, wasn't that failing of the system that they were able to infect him?
Now look, the working hypothesis is that the person in that room, not people delivering the goods to the room, but the person in that room, somehow transmitted the virus from them to the security guard. Now this is not typical by any means. We know that viruses such as this, in all but sort of extreme circumstances, transmits from droplets. So droplets that people breathe out, cough out, sneeze out, and fall to the ground within 1.5 metres of somebody. So our policy is that the security guards who are static security guards sit more than 1.5 metres away from doors. If they hear anybody coming to the doors, or there's any inkling that the door is going to be open, they've got ready access to masks and to eyewear, and they're trained and advised to put that on to prevent any infection if they have to get closer to that person. This person, there's no evidence at all that he did anything apart from what was in the protocols.
So I mean, obviously, I'm assuming that he's been interviewed by people.
He has, yes.
Has he been able to detail whether he saw or came in contact with the person opening the infected person inside the hotel, opened the door? Because otherwise, then the only people between him and the infected person are the people who made the door to the door.
And a very thorough contact tracing investigation has occurred, and all of those people would have been interviewed, and a risk would have been ascertained, and there's a sizable number of security guards in that hotel that have deemed as close contacts, around 30. So exactly the people, if they visited that room, if they were deemed to be close contacts, then they would be in quarantine and would have been tested.
Do you know the transmission? I was sort of trying to get into the transmission from the bloke in the room, the security guard sitting there with him.
Well, again, this is an unknown, so it's a working hypothesis, and we haven't really nailed it yet. But that's understandable. I mean, we're dealing with a virus here that's changing, and up until fairly recently, it was pretty clear that the transmission occurs when you have this droplet infection. Now, we don't know whether the higher transmissibility of this virus is caused by it being able to be transmitted via air. But we just have to be open to all options here. Look, there's no evidence for that to happen, that happened. So the security guard says that didn't happen, and the people who went to deliver the goods to the room all wore PPE. So there's no evidence for that.
You've asked the person in the room, was there any point they left?
They would have been asked that, yes. Look, I'm saying that that's one of the options, and it goes against what we understand about the virus. It may have been that a surface was contaminated by that person in that room somehow, and he touched that surface and put his fingers in his eyes or his mouth. That's another possibility. We haven't worked out exactly how that transmission event has occurred.
So exactly what is your response been? Does it mean
He would have to go into the room.
You would expect so, yes. But if somebody came, say, to the front of the room and coughed and put some spread virus on the walls or the carpet around, I mean, this is fairly improbable. But we have to keep all of our options open. We just don't know how this person became infected. But
Given that the Minister told us yesterday that it's not compulsory to wear masks while you're working in quarantine all the time, what are you going to do about that?
well, we've already done something about that. So, irrespective of the mask wearing requirement for the lockdown provisions, we have brought into place a new policy where all people working in those hotels in a risk situation will be wearing masks. And that policy will be examined by Professor Romanthry as part of his inquiry, and will determine what happens from
so
now
as
on.
we speak, they are all wearing masks. Is that correct?
Not make sure people were wearing a mask?
Look, that policy around mask use, so the policy is that guards who are static guards on the floors guarding rooms, and if they can keep more than 1.5 metres away from somebody, and they have got a mask ready to don and some eyewear ready to don, if the door's open or somebody comes close to them, then that's where they put it on. Now, that's what the policy is. Now, that policy is based on advice from a very, very experienced infection prevention and control team, and we're lucky in this state to have an excellent team. And that question has been put up a number of times, but on balance, the policy decision was that these guards didn't need to wear masks. Now, you need to remember, we all need to remember, that there's been around 37,000 people in those hotels under this policy, with several hundred of those that have become positive. And we haven't had any breaches. Now, something is different in this circumstance, and we have to learn from it, and we have to change our policy. So, in response, if that's required. And one of those changes is a requirement that these guards now need to wear masks at all times.
Can I just clarify, are they wearing masks now? Is everyone wearing masks now?
Sorry.
Every security guard in hotel quarantine at this point, as we speak, wearing masks, suitable masks?
Yes, they'll be wearing masks, not only because that's what
Will be, are they?
Are they? Yeah. Because for two reasons. One of them is that's part of the lockdown provisions, and two, because that's policy. So yes, that's the case.
And that policy will remain in place for lockdown?
That will remain in place for the foreseeable future. As I said, that policy position will be looked at by the Professor Romanthry's team, and we'll leave it.
And the difference here, though, that we now have a different strain of coronavirus. So we've known about it more than time. I think the case of New South Wales and how one of those cases is the case of Brisbane, the African South Africa. Weren't there warnings?
Well, look, there were warnings there. I mean, we know that this is a different virus. It's more transmissible, by around 50% more transmissible than others. But that doesn't mean that the transmission dynamics is different. That doesn't mean all of a sudden that it's turned into something that can be transmitted through the air. It's just a hypothesis at the moment. The learning so far is that it's not something that is transmitted. It's not a pathogen that can be transmitted via the air conditioning, for example. It's about airflow and ventilation in the hallways. And it may have been the case that just the airflow situation of that particular floor and where that person was sitting and the several times the door was opened, that something happened there, a chance event where that person became infected. Now that's our working hypothesis. These are new viruses where it takes some time before we understand exactly what it means that they're more transmissible. So in light of this case, and the first time we've had a case for 37,000 people who've been in the hotel quarantine, we have changed our policy and we'll examine it very closely. And other states and territories are examining that as well from experience in their own states and territories.
It was just a needless risk though, wasn't it? I mean, there was always a possibility that this could happen, and what was the harm in having to wear a mask?
You're right, there's always a possibility, and every policy is based on a sound risk assessment. Now, wearing a mask for 12 hours straight sitting in a chair is an uncomfortable situation. It's very sweaty, it's hot, and the more you have it on, the more irritated you get and the more chance you have of touching your mask. So there's downsides to wearing masks, and that's one of them. However, and on balance, our policy position was that masks weren't necessary because the risk of infection was considered to be negligible versus the downsides of wearing masks. Now, we've switched that position, but now because of this circumstance, and every time something like that, some incident happens in COVID, we aim to learn from it. And we will be advising them, our infection prevention and control experts will advise them on what type of masks that should be used.
Run kind of hard, this is what the public thinks. You've got 2 million people now wearing masks outside of the park. You've got a hotel with people in with the most varied strain of the coronavirus that we know, and you're still trying to stand there and tell us that there was no necessity for people sitting there to wear a mask. That seems absolutely ludicrous to the average punter, let alone experts.
As I stated, that question has been asked on a number of occasions, and our expert...
Did you get it wrong on this case? In this case, did
well,
you get it wrong not to have, in that particular hotel where you're dealing with these particular patients, people wearing masks?
I think our processes for developing policy are sound. And I think at the time that the policy was put in place, that was the right thing to do.
It was the right thing to do, even though you've just shut down an entire state for 5 days.
Sure.
It was the right thing to do.
Well,
wear a mask.
We've learned from it, and we've now asked security guards or required them to wear masks. So it wasn't as if there was no risk mitigation in place. The guards had masks and eyewear close to them in their pockets. And each week, the Infection Prevention and Control team audits each of those hotels, and they have reported back to me that they are very pleased with the level of compliance with that policy. So those masks and eyewear are close to them all the time, and from what we understand, they use them. So it wasn't as if there was no risk mitigation in place. We've put an extra level in now, and that is to require them to wear masks all the time. But I could also just reiterate that point. When you're wearing a mask, especially for a significant period of time, you play with it all the time. Lots of journalists here today are playing with their masks all the time. It's not a panacea. There's downsides to it.
Not standing within 2 metres of someone with
sure,
the most variant,
sure,
but potent strain of the
but if a person had virus on their hand and they played with that mask, they didn't know they had the virus on their hand, and they played with that mask, when they took it off, they didn't do that appropriately, then there's a risk that could happen. So wearing masks is not a panacea, and the policy position we've got to at the moment is that it's required, and that will be further reviewed.
There's huge public concern about people wearing...
Hang on, okay, just... Sorry.
If the guys wouldn't go to the room why is that still the case? If the guys only go to the room January 23, 25, 26, transmission of the third,
Look, we're not certain. As I said, it's a working hypothesis. It's the best hypothesis we have, because that's the time when we've tracked his movements around the hotel, and we know where that case had been, what their room was, and that is the most likely hypothesis. He was sitting nearish to the room, more than 1.5 metres away, and that room, the door was open several times, and it may well have been that the airflow, in a chance event, was such that he became infected. But that's the closest, from my understanding, that is the closest he had been to that room, yes. Well, we do learn from it. We learn from everything that happens in COVID. I think the scenario you're talking about is what happened in a hospital environment. And clearly there was a lot of debate around mask use then. A very different environment when you have a ward full of people, for example, with perhaps low ventilation or airflow in that room, and people shouting and yelling, and also undertaking procedures that might generate those aerosols. So it's a much higher risk environment to be in a hospital ward with COVID patients around. At the moment, we have around 1% of our returnees from overseas have got COVID, and they are in a room with the door closed almost all of the time.
Could I just ask about the...
Sorry, just one other thing about that. There's a national group that advises the Australian Health Protection Principal Committee that is made up of the best experts in infection control in Australia. They've certainly analysed all that information, and the policy position that is at the moment, national policy position, was consistent with our position for the mask use for the security guards.
So are you saying a public concern seems to lie with the other issue of the security guards working 2 jobs? You will be advising Professor Wiramanthi. So what is the Health Department's advice or position or policy now that you will be handing on to the authorities as they investigate this breach?
About working 2 jobs? Well, I think you would have heard some discussion already about that. We will be leaving that, I think, until the inquiry is over to really determine exactly how that rolls out. But that's our position at the moment, that we will look towards that. The inquiry will be reasonably short, so we'll have that information soon. But there is a position where the Department of Health may well pay people to extra money or arrange for that to happen if they only do 1 job.
Given this position, what's your stance now on moving all positive patients out of the hospital or to isolated hotel as it's done in South Australia?
Yeah, so we differ a bit in that way from other states and territories. Our policy position there has always been that if somebody becomes sick, they stay where they are. And the main reason for that is every time you move somebody who is sick, there's a risk to people. There's a risk of people escorting them down the stairs, getting into the ambulance, taking them to the hospital, unloading, etc. So there's a lot of potential problems or potential risk breach times there. So our position has always been to keep them in situ, and that's where we still are, and that's our intention to stay at that. I mean, that may be something that Professor Wiramanthi's team looks at as well, but we feel that that is the best policy position to have.
We heard about the close... can I ask one more question?
Yes, they were. From the 29th, yeah.
And have their close...
Sorry, no, have it on the 24th, right?
No, that's right. So would they would be tested 7 times?
Well, they would have been tested weekly.
They're all negative.
Yes, there's no positive tests.
Did they go into the room?
They stayed outside the room.
Are you tracing their close contacts as well?
Pardon me?
Are you tracing their close contacts?
No, we aren't, because at the moment there's no evidence there's been transmission to other people. As soon as we do find that evidence, if it occurs, then we will do that.
Are you working on... You're thinking he may have contracted it from one of those people, though?
No, we're thinking that he may have contracted it from the person in the room.
Without having visited them?
Yes.
He did contact him on day 24th, and he had daily testing in place. Is that picked it up? 25th didn't work, 26th didn't work, 27th didn't work?
Clearly, if he got tested on the day before his symptoms, or the day before that, or perhaps even the day before that, he would have become positive. He probably would have tested positive, yeah. He was being tested weekly, and he had 3 weekly tests. We know the last one was on the 23rd, and that was negative.
So I carried that daily testing in place more than 3 weeks on the side on that has contributed. You want to answer that question?
Maybe the minister.
So in answer to your question, no. What would have happened is that he was tested on the 23rd, he worked on the 24th, he didn't work again, wasn't due to work again until the 30th, so that would have been the first date that he would have been tested and had incubated the disease enough to be detected. So he wouldn't have incubated the disease enough to have produced a positive result by then.
No, I didn't say that.
No. So you were saying. Yep. Any other questions? Sure.
Sorry, I missed it. Like to remind you, yesterday the police commissioner stood there and said that we've got to deal with rumours, not facts. the last 2 days you've botched a couple of things. You said that the company wasn't told until, was told on the 28th, which turned out to be 2 days early, and you told us yesterday that medicine was delivered to the room to come on with. Where did that misinformation come from?
Well, medicine was delivered to the room.
By the security guard,
Yeah, that's right.
That was just quite a sort of significant point.
Yeah, so as policy makers and communicators, we have a duty to balance both the information that we have to hand, to put that out into the public domain, because we know that there's an appetite for information, and being confident about the veracity of that information. So we put this information before you to continue to inform you as we continue to come across the facts.
Who's let you down? Who's let you down there? Because that's quite interesting that you said yesterday that the security guard delivered the medication.
Well, look,
24 hours later, it wasn't him. I mean, how do you get that wrong?
Well, as I said, look, we rely upon information from officials from right across the government to provide information to the public, and we do so in good faith.
Minister, just on testing turnaround, there's reports that some people who were tested on Monday still don't have their results. Is that quick enough?
So today's Wednesday, so they would certainly have been told today. Look, we usually say between 24 and 48 hours. I've heard reports of some people getting their test results back as quickly as 2.5 hours. So, you know, people's experience of it will vary, but we just ask people to be patient. Thank you.
Look, thank you. As we've been speaking and answering questions, a couple of points I think are important to clarify. Anticipating a number of these questions, I spoke to the Police Senior Investigating Officer about 1 hour ago. I don't have his written report, but my recall of his verbal report to me is this. The person who had the UK variant strain, that person in the room, on the advice I've received, has not left that room in that period. That person says that whenever someone came to the room, they were wearing PPE to deliver. The 7 instances that Minister Cook relayed to you, I'm advised, were delivered by security guards wearing PPE and other staff. The security guards, as I understand, were delivering medicines. There was a staff member delivering food on several occasions, and there was also some flowers delivered. So 7 times that door opened. The person in the room who's infected had been actually quite unwell and remained longer than 14 days, up to 3 weeks. That person has been interviewed and says at no time were any of the people at the door when the door opened not wearing PPE. That's the advice I've received. The infected guard, case 903, was seated, static, guarding. There are 3 guards on that floor who remain there to make sure people don't leave the rooms. That guard is the infected 903. The information I received from the SIO is that on his information, he was seated on the same wall as the door, about 3 metres away. And that was the role of security guard case 903. He did not, on the information that he's been spoken to, and no need for him to go to the door of that infected room. And there's no information, and he has not told us, and nor is there any information to suggest he's gone in the room. So clearly the questions you put to Dr. Armstrong about air, etc., are the matters that we'll be relying on Professor Wiramenthry to give us the clinical public health advice. I, as Police Commissioner, and police officers are not in that role. We just needed to establish the chronology of the facts about that. I can also confirm there is no CCTV on that floor. And in that respect, we can't corroborate as we normally do, but I again stress, this is not a criminal investigation. We're just seeking to establish exactly how this went on to complement the public health role, and Professor Wiramenthry will be providing enhanced public health advice when we meet with him tomorrow evening. Just in respect to masks, we've had this conversation obviously since this has occurred. The directions that I've signed that require me and everyone else to wear masks remain static, and you must wear masks. That does include all staff at the Sheraton 4 Points Hotel. So all of the guards, including static guards, are now wearing masks, as is required by everyone in the regions affected by the emergency directions. So all of them are now wearing it. The questions I've heard, and I don't propose to answer further public health questions, it's not my role, but I thought it's very important to establish that chronology of what's taken place, and that hopefully clarifies several of the matters. Thanks very much.
Just a few quick questions from me.
Can I just say one thing beforehand? There's one thing I didn't say earlier, and that is this. We're at the fire ground today in the eastern suburbs in Mundaring. They're expecting extremely strong winds later on this afternoon. I think this is very important for people in Shady Hills and Bullsbrook. Southeasterlies are on their way, and we expect the fire to spread towards Shady Hills and Bullsbrook. So that's why we're saying, if you can leave, please leave now. Please follow the advice. Please act to save your life. Sorry, Jeff.
Real quick one. You're hoping if we've got no more cases that the lockdown could be lifted at 6 p.m. on Friday night. Does that mean that you could have weddings on Saturday?
Well, you can currently have a wedding. Sorry, no, you can currently have a funeral. Weddings were not allowed for 5 days. As of Saturday, we'll announce, I think, tomorrow or Friday, what the exact rules will be, but we'll essentially move away from lockdown and we'll go to more eased controls, but there will still be controls in place. I would expect that we'll finalise the rules on Friday morning.
Schools, you expect that they will be open on Monday?
Yes, our expectation is schools will go back. We'll make decisions about mask wearing and all of those sorts of things over the course of the next couple of days. But assuming no cases between now and Friday, we'll step down the rules. We'll end the hard lockdown on 6 o'clock on Friday night, but there will be some restrictions still in place. This is what has happened in Adelaide and Brisbane and Melbourne when they come out of hard lockdown.
And one last one for me. Is it worth locking down 2 million people behind that?
We've made decisions based on health advice, and we wanted to crush the virus. Don't let it get a foothold. We're not out of the woods yet. There could still be cases out there. That's why we're requesting people to get tested, as many tests as we can possibly do over the coming days and indeed beyond that. I'm going to say it again, and I say it all the time. I meet in shopping centres on the streets every single day people from Britain. 1 in 8 West Australians was born in Britain. They have family members over there, and they tell me every single day what's happening in Britain, where their family members are dying, their friends are dying, their streets are closed down, their shops are closed down, and they've gone through it for a year now. I just don't want to see that happen here. So we're going to be highly cautious and highly precautionary. And if we don't get any cases, well then that is a good outcome. If we had cases, well then obviously that would be a terrible outcome. But adopting a tough, harsh approach rather than, allowing the issue to go on for weeks with sort of part lockdowns and part closed down, or months, as New South Wales has done, I'd rather just kill the virus, crush the virus in the course of a short period of time, rather than have months of lingering rules, restrictions and outbreaks. That would be my preferred option. Sorry, you keep putting your hand up.
Thank you. Just 2 quick questions, just to clarify for the public. One, is any security guard currently working 2 jobs, or have you put an end to any security guard working 2 jobs? And secondly, if unfortunately the gentleman's 903's housemates were to test positive, would that mean the lockdown
Well, we'd get advice on that. On the housemates are the most likely people to be positive. The good thing is we've got them into quarantine and they've been tested negative. So therefore, we don't think they've been infectious in the community and they're in quarantine. If they stay in quarantine and they don't become infectious, that's a good thing. This is highly precautionary about these people, as indeed it is about all the other people. There's a lot of people in quarantine currently out of this. So it's just highly precautionary. If they keep testing negative, well, that means they were not infectious in the community, and that is a great thing. In terms of the your first question in relation to... we expect to bring in new rules around that over next week, over the course of next week. But I just remind you, I said this yesterday, it's not a silver bullet. Even though you can't work a second job, doesn't stop you going to the pub or to the shops or to a restaurant, or indeed standing in a crowd, catching a train, catching a bus. It's not a silver bullet. We're doing it as another precaution, but it doesn't solve the problem. Because the virus is highly infectious, it's insidious, it will continue to be a risk to the state until such time as we have a strong vaccine that works.
So, Premier, what's your reaction to the fact that guards weren't someone
Well, our hotels are managed by health. They're subject to the rules put in place by infectious disease experts. We allowed the health advice to prevail. We obviously don't interfere in that. I'm not a doctor. The Minister's not a doctor. We're not professors of infection. We allow the experts to run the hotels.
You wouldn't pass the pub test, though, that people going into those environments. I mean, I know people that have to go to the GP for 3 minutes to pick something up. You have to wear a mask mandatorily. So it just seems like a nonsense.
Yeah, well, we have not, over the course of the last year, questioned the health advice. We've always followed the health advice.
Time you started.
Well, it's stood us in good stead. Over the last year, we have had the best outcomes of anywhere in the world. Obviously, this has been a significant setback. We don't hide from that. But we have followed the health advice. On this issue, now the health advice has changed, so we are following that.
We have quite a highly proportionate response to lockdown. Highly proportionate response. Why do we have the same approach to the hotel crisis, given Victoria?
Well, as I said, the infectious disease experts run the hotel quarantine system, and that is their job. And we have followed the health advice the whole way along.
When were you made aware of this mask policy?
To the best of my knowledge, the other day when this came to light.
1 week ago,
I can't hear you, I'm sorry.
1 week ago, if you were in the corridors of a hotel quarantine situation, would you have been wearing a mask?
Well, if I had been in a hotel, I would have worn a mask, yes. But obviously the security guards have been following the rules that have been put in place by the infectious disease experts.
Did somebody owe the West Australian public an apology here?
Well, obviously I'm very sorry about what's occurred. I'm not afraid to apologise. I'm very sorry about what's occurred. This has been debilitating for many people. And obviously we went for 10 months without a single case, and everyone in Western Australia, I think, was very happy about that. This has been a shock to all of us. We have swung into action on Sunday very quickly. I mean, within a matter of hours, we basically put in place a huge number of rules, and people did the right thing. I mean, I was at a coffee shop getting a takeaway this morning, and everyone was wearing a mask. People on the drive-through were wearing a mask. Everyone I see on the street has been wearing a mask. West Australians have done the right thing in difficult circumstances. I think what has happened has shown that we should continue to be precautionary and cautious. We should continue to rely upon all of the rules we've put in place over a long period of time. We just don't want to have a significant outbreak that causes even greater disruption than what we're going through.
In terms of coming out of the lockdown, you mentioned coming out gradually. How significant a reopening would you expect after Friday? Things like hospitality venues.
Yes, I expect that will be the case. There may be gathering limits or rules about the number of people who can attend. Those sorts of things are what is currently being worked on. A greater proportion than their population share.
Yeah.
I think he just says that takes most
They've got the greatest risk because they're taking more quarantining overseas tablets, so they should get a great proportion of the vaccine.
Well, you know, per head of population, Western Australia since October has been taking the greatest number of returning Australians per head of population. So, but I just think that each state should get a population share. That would be a fair way of distributing it. I don't think we should be arguing about this. This is something that should be cooperative. It shouldn't be state against state. It should be all the states cooperating and working out a regime that works for all Australians.
Just by the election. Last question for Jacob. Brits are about the issue. When do you imagine
Well, obviously we'll get to the end of this week. We'll make further decisions then in relation to it, but our focus is on dealing with these two crises. This bushfire is a huge risk. I just do not want to see anyone die out of this. This is so worrying. And COVID, we're managing it as best we can. Thanks very much, everyone.